Agreements reached on CXC'S 2021 examinations. CARICOM chairman wants crime and violence addressed as a public health threat. And the Caribbean Public Health Agency bemoans alarming rates of childhood obesity in the region. Welcome to this week's episode of the CARICOM News Time. I am Tusankin English Francis. Thank you for tuning in to our weekly newscast. The CARICOM Council for Human and Social Development, COSOD, has committed to working with the Caribbean Examinations Council, the CXC, to preserve the integrity and validity of the regional examinations that are scheduled for the period June-July 2021. The COSOD met on February 26th and March 1st and reached several agreements on the administration of the 2021 regional examinations, including that the examinations will be held in their original formats. That is, the Caribbean Advanced Proficiency Examination CAPE, the Caribbean Secondary Education Certificate CSEC, Papers 1 and 2 and 3 for private candidates, and for the Caribbean Certificate of Secondary Level Competence, that is CCLSC, Papers 1 and 2. Chairman of the COSOD, the Honorable Jeffrey Lloyd, Minister of Education of the Bahamas, told a post-meeting media briefing that after careful analysis and with consideration for the well-being of the students, the COSOD also extended the deadline by which students should signal their intention to defer the sitting of the exams. Candidates now have until the 1st of May to do so.
The COSOD expresses its appreciation to the CXC for its efforts to ensure the smooth transition and matriculation of the region's youth to the world of work and post-secondary or tertiary education. Recognizing the impact of COVID-19 pandemic on equitable access and the continuity of learning, in their deliberations made every effort to advocate for concessions to be provided. Thus, the ministers endorsed the recommendation to provide additional time for in-person teaching and learning to complete the school-based assessment, close teaching gaps, and increase the chances of successful outcomes.
COSOD agreed that CXC will share with the Ministries of Education the broad topics for Paper 2 5 weeks before the start of the examinations. However, Dr. Wayne Wesley, Registrar and Chief Executive Officer of the CXC, has cautioned it is important for teachers and students to complete the entire syllabus for their respective examinations.
As it relates to the sharing of topics, while CXC will submit to all Ministries of Education the broad topics to be assessed on Papers 2, 5 weeks in advance of the administration of the examinations, which means on May 10th, that listing of topics will be available to the Ministries of Education. It must be said and indicated, all candidates must be reminded that all topics are covered in Paper 1 for all subjects. In addition, there are certain subjects for which the details are not readily specifically available in the syllabus. We will make sure that information is provided.
Of interest to young people seeking entrance into the University of the West Indies, the UWI, the university will consider their Year 1 CAPE results. The COSOD agreed to extend the matriculation waiver UWI introduced in 2020 to allow it to consider CAPE candidates for admission based on Year 1 results, given that the Year 2 results were released after the start of the academic year. Minister Lloyd said the Caribbean Primary Exit Assessment is scheduled for the 27th and 28th of May, and the results can be expected by the 15th of June. The period for the online training and assessment quality audits for Caribbean vocational qualification is May to August 2021, based on agreements with individual participating territories, and the Ministries of Education will receive the results in the last week of September. CARICOM must continue to address crime and violence as a public health issue. Prime Minister Keith Rowley of Trinidad and Tobago told his colleague heads of government recently. At the opening of the 32nd intersessional meeting of the Conference of Heads of Government on the 24th of February, Dr. Rowley, who currently chairs CARICOM, anticipated that the community could soon refocus efforts to convene a high-level multi-sectoral summit to address crime and violence as a public health threat. He said amidst the fight against COVID-19, the scourge of illicit trafficking in goods and persons is disconcerting. Prime Minister Rowley, who holds responsibility for issues pertaining to security in CARICOM, lamented the shocking acts of violence against women and children recorded during the pandemic. Strengthening CARICOM is the antidote for COVID-19, Prime Minister Ralph Gonsalves of St. Vincent and the Grenadines said. Speaking as the outgoing chairman of CARICOM at the opening of the 32nd intersessional CARICOM meeting on Thursday, the 24th of February, Prime Minister Gonsalves addressed the devastating impact of the COVID-19 pandemic on the economy and the vaccination against COVID-19. The two fundamental issues in that context are jabs and jobs, he said, as he linked the reversal of unemployment levels to successful vaccination programs both within the community and in tourism-sourced markets. Prime Minister Gonsalves expressed deep concern about Dominica on the latest list of non-cooperative tax jurisdictions by the European Union.
There's no inclusive process with the European Union, with the European Commission, and yet they simply use their power to declare another country a non-cooperative jurisdiction, even if that country satisfies all the inclusive processes at the OECD or the FATF. And for it to be done at a time of the pandemic is just really awful.
The Caribbean Public Health Agency, CARPHA, has called on all countries in the Caribbean to strengthen their fight against childhood obesity. As it says, data shows the region trending among the highest overweight and obesity rates in the Americas. On World Obesity Day on the 4th of March, CARPHA urged countries to develop and implement policies to prevent childhood obesity, including the consumption of healthy diets and increase in physical activity, as well as front-of-package labeling in food products. At the just concluded CARICOM Intersessional Summit, Chair of CARICOM, Dr. The Honorable Keith Rowley, called on the community to redouble efforts to reduce mortality associated with non-communicable diseases.
Regrettably, we witnessed the disproportionate and adverse impact this virus has had on persons with comorbidities. I recall that on September 15, 2007, CARICOM heads of governments met here in Trinidad and Tobago at the first CARICOM summit on chronic non-communicable diseases and adopted the Declaration of Port of Spain, uniting to stop the epidemic of chronic NCDs. Today, almost 15 years later, the region continues to battle with high incidence of mortality due to NCDs. Often, these illnesses develop due to poor quality diets and lack of access to fresh produce. We need to redouble our efforts in addressing NCDs and exploring their nexus with food and nutrition security.
At the individual level, CARPHA is encouraging us to become more physically active, reduce our consumption of salt, fats, and sugar, while increasing our consumption of fruits and vegetables. The resilient recovery we seek cannot materialize until we tame the beast of COVID-19, CARICOM Secretary General Ambassador Erwin LaRocque has said. In his address to the opening of the 32nd intersessional meeting of CARICOM heads of government, the Secretary General said the road to recovery could not wait until 2022 or 2023, as some are predicting. Noting the urgency of this time applies to vaccine access, he said CARICOM would continue pursuing all possibilities to ensure equitable access to vaccines for its populations.
CARICOM repeats its call for a global summit to address equitable access to COVID-19 vaccines, which should be conducted in the context of the World Health Organization's Act A Facilitation Council. In pursuing the objective of acquiring sufficient vaccines for all people, Member States have signed on to the African Medical Supplies Platform to take advantage of the economies of scale which the facility provides. I want to thank the African Union for making available to CARICOM 1.5 million doses of vaccines through their procurement arrangement. We've also been in discussions with development finance institutions to make the case for concessional funding to purchase vaccines, and with PAHO to assist in acquiring additional vaccines. These efforts will supplement the doses allocated to our member states by the COVAX facility to vaccinate 20% of our populations.
The Pan-Caribbean Partnership Against HIV and AIDS is seeking to mitigate against the reduction and disruption of financial support for critical services amidst the COVID-19 pandemic. Concerned that COVID-19 threatens to undermine the region's gains in response to HIV, it recently launched a social contracting toolkit aimed at keeping up support between government and civil society organizations to maintain support for HIV, tuberculosis, and malaria.
With the disruptions caused by the pandemic and the missed targets, we have no choice than to act by accelerating our work by ensuring that testing and prevention services are continued and sustained. People are linked and retained in care and are virally suppressed. This will not and cannot be achieved unless we all work together towards this common goal. It is therefore against this background that PANCAP, along with key partners, have been working to promote social contracting in the region. Social contracting is a process by which government funds are used to support non-governmental entities such as civil society organizations to provide services. It involves a legally binding agreement between government and CSOs where the government agrees to pay CSOs for service delivery and CSOs agree to provide specific deliverables. Social contracting mechanisms serve as an avenue through which critical HIV services provided by CSOs at key populations can be sustained.
For these and other stories, you can visit the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org. Like our Facebook page, follow us on Twitter, and be sure to subscribe to our YouTube channel. Thank you for watching. See you next time.